big time is Raywat Deonandan. He is an epidemiologist at the University of Ottawa. In a few minutes, we're going to talk to Raywat about somewhat non-COVID issues. We'd like to find out a little bit about him and FAM, but Raywat, obviously, Omicron front and center. BC's health officers saying that they have administered 20,000 COVID tests yesterday. Provinces beyond capacity of testing, records in Ontario, your home province, here in Manitoba, 742 daily cases, the highest yet in the pandemic. What do you make of all the numbers here and Omicron in general?
Buckle in, it's going to get worse. The modeling is pretty decisive on that fact. I've seen some scary numbers. We might be peaking in Canada at 200,000 cases per day sometime in February. This wave might be over in March or April, at which point about 19, 20 million people will have been infected in Canada. This is the great infectious, contagious disease Omicron is. And the big question, of course, is what will be the toll both on the population in terms of sickness and death, but also on the healthcare system. So that's largely unknown. That's why we're scrambling to figure out the severity of this disease.
As we continue forward, because that's the only option that we have at this point, a lot of our listeners are saying, listen, why did they institute a lockdown instead of a strong urging to limit gathering sizes? Is this a case of the horse is already out of the barn, or are there things that we can still do to mitigate this?
I think it's a case of public health being the art of the possible. So is it possible to institute a lockdown lasting more than a few weeks? I don't know if the public tolerance is there for it. And frankly, we have the tools, I think, to avoid having to do so. It's a matter of using those tools. And those tools include everyone getting an N95 respirator-style mask, not these baggy surgical masks, because COVID is airborne, that matters. People investing in air purification, HEPA filters, or keeping windows open. People deliberately, or choosing rather, to limit their exposures. And using rapid test to high effectiveness. It's probably the most underutilized tool in our arsenal right now, use of rapid tests to control our socialization. And lastly, and most importantly, we still have vaccination. Vaccination works extraordinarily well, even for Omicron. It keeps people out of the hospital. And that booster shot will blunt the penetration of disease into communities as well. So we have all these tools, all these policy levers yet to pull before we pull the big one of a lockdown.
And Raywat, your last statement is what I think people are hanging on to, saying that, you know what, I'm double or triple vaccinated, that I'm mitigating, but I'm still gathering with friends and family for the holidays. And I've had so many conversations with people who are shrugging it and saying, you know what, I'll probably get it anyway. Yeah. What's your response to that?
I think eventually almost everyone is going to be exposed to it. That's not the same as getting it. Getting it means, actually being infected. And that's not guaranteed. Keep in mind we have children under 5, including mine, who can't be vaccinated, who have a chance of being hospitalized and killed by this thing. So this flippant attitude towards infection really rubs me the wrong way. There are people we still need to protect in society. Also, if we delay getting exposed, then we preserve the healthcare system. If the entire country gets exposed this week, that's maybe hundreds of thousands of people ending up in the hospital at once. We can't handle that. So if you want to preserve society and the pillars of society like our healthcare system, avoid being exposed. That means wearing a mask, keeping your distance, keeping your exposures low while we process this wave and get through it in a couple of months.
And Raywat and Julie, by the way, earlier on the news, we had Manitoba's Chief Medical Officer of Health, Dr. Brent Roussin, basically saying that as of next week, we're going to see those restrictions and those lockdowns. And my sense is not just in Manitoba, but across the country, Julie, that those announcements are going to be made early next week.
That's all of the indications that we're hearing, at least when it comes to large gatherings. Lockdowns, I think, as Raywat has indicated, are a little more tenuous. We'll have to wait and see if that happens, but large groups appear to be off the table as of next week. When you look at the numbers, Ray, across the world, especially in jurisdictions who have dealt with Omicron a little bit longer than we have, I think many of us have been keeping our fingers crossed that it holds true that there are fewer people landing in the hospital with Omicron. Is that still the case, what you're seeing?
Well, the UK has the best data on this, and they recently released some studies that give us a bit more clarity. And it's difficult to dissect intrinsic mildness versus non-intrinsic mildness. What I mean by that is it's complicated because so many people are vaccinated now. It's hard to say whether something is more mild because of vaccination or it's more mild because it's intrinsically more mild. But some good studies out of the UK suggest that Omicron probably is intrinsically more mild, but not by a lot. So you've got the rate of getting to the ER, for example, is probably 30% that of Delta, and the rate of ending up admitted to the hospital is 50 to 70%, which is great, but it is so incredibly more contagious that it's not good enough. It's not good enough to keep large numbers of people out of the ER and out of the hospital. And though it is probably milder, it's not milder than Alpha. We've forgotten about Alpha. I mean, it's worse than the previous variants. Definitely worse than the original Wuhan strain. So there's a slight light there, and that is it's probably not as bad as Delta, but that's not something to write home about necessarily if it ends up still crippling our healthcare system.
With us is Raywat Deonandan. He is an epidemiologist from the University of Ottawa and someone that we have frequently chatted with over the last couple of years. It's his own fault. He wrote a wonderful blog post that was given to me by a friend of mine, and I thought, gee, he writes in a way that people can really understand. And his fault, again, picked up the phone and the email, and here we are a couple of years later. And I think, Ray, a lot of people feel like they know you, and so I thought we would ask you a few questions that we don't normally have time for as we head into the holidays. So if you weren't focusing your work on COVID-19, what would you be working on?
Good question. So I'm a global health epidemiologist. I do mostly evaluations of global health interventions that include infectious disease, public health strengthening interventions in parts of the world like Guyana and India and Trinidad and Rwanda. I did a lot of my work in reproductive technologies. I used to be a chief scientist for the federal government in reproductive technologies, actually. But before COVID, I decided that I'm winding up my career. I'm in the latter half of my career. Let's do some fun things. And I was going to dedicate the remaining years of my career to wacky topics like extraterrestrial diseases. In fact, I had a paper out on how to model a theoretical extraterrestrial disease. And I was bracing for the ridicule because why not? Let's enjoy life. But COVID threw me for a loop, and here we are.
So what do you like to do outside of studying facts and figures about, quite frankly, some topics that can be pretty tough and pretty doom and gloom?
I used to be a fairly serious writer. I still am. So I've written a series of books, including a novel and a short story collection, one of which won the National Book Award of the nation of Guyana, and the other won several other awards. So I was a serious fiction literature writer for a while. That doesn't pay the bills, but it's still close to my heart. And a big fan of martial arts, and mixed martial arts in particular. Lately, since I became a father, I've become a big fan of the Wiggles. So a lot of my time is spent watching YouTube clips of children's performers. That's my life now.
He's also a whiz with the Instapot. Your favorite things to make in the Instapot?
I am of Indian descent, so I make a lot of Indian food, and I am a vegetarian, not entirely vegan, but mostly. And Indian food lends itself well to a vegetarian cuisine. So I make a lot of, which recipes in particular, I'm not sure. I kind of make it up every day. But vegetables spiced in a South Asian flavor on a daily basis, which my neighbor enjoys because he gets the leftovers.
The aromatics of all of it.
Do you have fun with chickpeas, by the way?
Yes, he does.
Yes, I do.
Good.
Yes, he definitely does. And then you have such a unique, diverse household. So what will the holidays look like for you? Because as you said, you've got a little one in there as well.
Actually, I'm in Toronto right now. I live in Ottawa. My spouse and I just came to Toronto. She and the baby, the infant, went off to see her family, and they're going off to a cottage. And I'm staying with my family here to see my mother and my siblings. And we have separate, well-controlled bubbles with rapid testing and great infection control. So we're clear on that front. And my father passed away earlier this year, and so this Christmas, it's our first Christmas without him. And so we're having a somber time together. Just my mother and my siblings and I, and we'll be celebrating his life mostly. not to bring the conversation down. It's a joyous time still, but my heritage being what it is, a lot of food is involved, and as I'm also Caribbean, a lot of alcohol is involved. So that's what I'll be doing.
Well, the very best to you and your entire family, Raywat Deonandan. We've always appreciated your time and their time, because when we're chatting with you, it sometimes takes away from your responsibilities with them. We always appreciate it. The very best of the season to everyone. Stay safe and healthy.
Same to you. Thank you so much.
And have 1 or 2 for me.
Or 10.
Will do.